Hello, everyone. It's been a while since I did a video. I think it's about time. Got a lot of interesting insights. Uh, the more I get rid of disease that really matters, and start optimizing people, the more insights that I've been getting. And it really explains why we're getting such fantastic results in optimizing beings. Okay, so, I mean, if you're going to be fair, let me ask you a question. Um, if you stay with a medical practice over 30 years, you go to the same doctor, do you really think you're getting better or going to get better? Name one person that has. So the problem is that medical practice and everybody else, the whole medical practice is relying on metrics that are spurious. So basically, I'm calling it, I want to be the first to say, I think the labs are BS. They're actually bullcrap. They're not only spurious, but they are very likely harming you. If you're following, that's what I'm saying, that they, in fact, you may be better off never looking at labs. So why is everybody getting worse? Why do doctors get worse? Why are patients getting worse? Don't blame it on aging. It's not aging. Animals, as they get old, actually perform better, function better, and human beings should be doing that too. But we get more disease because we're falling apart. We're not tracking what we really should be tracking, not doing what we should be doing at a fundamental level. I mean, you can track things, but if you're not doing at a fundamental level, living correctly, you're going to be falling apart. So I want to talk about the nature of lab values. So a single point in time, every lab value is just frozen. It's a frozen measurement of a dynamic system. So let's take C-reactive protein, ESR, erythrocyte, sedimentation rate, glucose, LDO, testosterone. All of these fluctuate daily, hourly, and even minute to minute. So they're constantly changing. So, you know, when you measure it, it's not taken into consideration. You see a doctor say, well, we took this at 10:30 a.m., we took this at 11 o'clock. No, they just, take it at a single point in time and don't take in consideration what was happening during that particular time. So they're vulnerable to confounding. All your laboratory studies, I don't know of one. I mean, if you could tell me one that's not vulnerable to confounding, let me know. You're a researcher, you're a physician. This one does not ever have a confounding. You're going to find it, jump in AI, and you're going to find another study that shows it is vulnerable to confounding. So it's not true. I'm going to tell you about four things that are not vulnerable to confounding. Four things that will change your life. Stay with me throughout this video. Zero confounding. Zero. That means what you do that gets rid of it, that makes it increase, is worse. And what you do that decreases it is good. And there's no confounding, no confusion about it. We just need to follow and do it. But it's kept out of medical school because the establishment doesn't want it in there because they don't want you to get better. So confounding happens from stress, happens from sleep, happens from infections, happens from exercise, and even laboratory errors alter. It just change and give spurious results to these laboratory values. So a worsened C-reactive protein may reflect just acute stress, or it may infect infection or inflammation or progression of arthritis. So how do you know your C-reactive protein that was taken to see if you got inflammation wasn't because you didn't sleep good or because you did something good like you sprinted, you did a bunch of push-ups? Oh, you're running around thinking your C-reactive protein is really bad. Maybe it's because you're doing the right thing. Do you see? The confounding is you don't know unless you do a forensic examination analysis, like at a supercomputer level of so many different factors that could be contributing to that. And you got this time, well, I think your C-reactive. Oh my God, it is just so spurious. And relying on these blood studies to tell you whether you're healthy or not. So in the context of depending on these things without knowing the baseline trends, lifestyle, all those different factors, clinical presentation, a lab value at a single point in time, can just be completely spurious and even harmful to you in trying to get healthy. So what physicians actually use conventionally, not this one, is lab tests, blood, urine, sometimes stool panels. They'll look at that. Sometimes tissue analysis, imaging. They'll do an X-ray or CT, looking for a particular what is going on. Even MRIs and ultrasounds, vital signs. I use an MRI, but I look at it very, very different than other doctors. Vital signs to look at blood pressure, pulse, pulse oximetry, temperatures, physical exam. Very rarely done today. Conventional doctors mostly just do blood work, and I call it the big charade. Sometimes physicians just pretend to do a physical exam because people want it. But you're in your mind, the only thing you're doing is like X-rays, CT, and blood work. And then sometimes you, of course, pay attention to symptoms, what people are complaining about. So among all of those, labs are often dominant. They just really are what define what is mostly done. They're cheap, they're fast, they're defensible in litigation and insurance, reimbursement context. So it's just really what mostly gets done. But they're not true health metrics. They really don't reflect how healthy you are. You can have completely normal blood values, laboratory values, and be sick as a dog. Or you can have really abnormal lab values and be completely healthy. So they are at best screeners for certain levels of disease at best. The problem with defining health is the medical system does not actually measure health. It measures the presence and absence of disease. That's what they're doing with these laboratory studies. Risk factors for disease, cholesterol, HbA1c, C-reactive protein, PSA. That's all they're looking at are risk factors, but they're not really metrics of disease or health. There's no universally accepted in the conventional health space biomarker for composite score that captures real health. I have that. I am a health optimizer physician. I track, and I'm going to stay with me what really reflects health and what really reflects disease. But it's not done in the conventional space. It needs to be, but that's why we're getting the best results in the world. We are teaching people what really matters. But someone have normal lab values and be metabolically compromised, physiologically sick. And then have structural disease. So structural disease is disease that has structure in your body that's completely ignored, like visceral fats, epicardial adipose tissue, which is fat around your heart, and myosteatosis. So it's this fat within your muscles. So maybe a good example, it'd be a good time to just show what those are real quick. Visceral fat is this white stuff in the middle. It's fat, it's white. The muscles are dark. You see the white stuff in there? That's fat in the muscles. Compromise those muscles. And then another area of structural disease is subcutaneous fat compartment. You have deep subcutaneous fat right here, and you have superficial subcutaneous fat. And you can even see the two are different. That black line separates them. But this is kind of modeled, and this is very kind of white. This is homogenized. This is heterogeneous type of signals. So you can see all that black modeling. It looks just like the fat in there, but this is very different because they behave very, very differently. But nobody's tracking that, paid attention to it. So, but I want to point that out because that's what we do. That's what in my medical practice, when I teach my physicians who are part of my medical practice, to track, to improve literally the improvement of people or the worsening of people. So beyond labs, what could define health? Well, we step outside the standard paradigm. That conventional medicine follows metrics that reflect you want to use structural imaging. You want to be looking at visceral fat. You want to be looking at epicardial fat. So let's take a look at epicardial fat so you have an example of what epicardial fat is and why that is so important. So epicardial fat is fat around the heart. So take a look at these images here. And this is visceral fat, and this is a heart. So this is the abdomen, this is the chest. The middle of the right lung and the left lung is the heart. You can see that white stuff around that structure there. That heart is fat around the heart. So you want to track visceral fat, you want to track heart fat, and you want to track myosteatosis. So myosteatosis are these fatty infiltrates, these fat streaks in the muscles. You can see the muscles are dark, and those fat streaks start depositing inflammatory fat, shrinking the muscles, and decreasing the performance. That's what you want to follow. You want to track that structural disease, and then you want to target it and get rid of it. And through Fidelia, utilize an MRI. And there's also functional capacity measurements that we could track, like grip strength, sprint performance, and those are all functional measurements of functional capacity would be important to follow. And then resilience markers like heart rate variability, recovery time. That means how fast do you recover after you've exercised, your ability to recover from exercise. And I'll have some videos on this in the future, just how incredibly fast I'm getting my clients to be able to recover. Super interesting. Even gray hair guys. Shocking. Yeah, shocking what happens when you get rid of this structural disease. And then cognitive performance, including under stress. That's an interesting measurement of resilience. And then microbiome composition, your species of, your degree of variability and diversity of your microbiome, all are metrics, really fantastic metrics of health. So these reflect how the organism, a human being, is actually functioning, how they're adapting, not just what's floating in the blood at a particular one point in time. That is spurious if you're just looking at one moment in time. So physicians overwhelmingly use lab values and some imaging to pronounce someone is either healthy or they're diseased. They do not have a robust framework for declaring somebody is truly healthy. In fact, healthy, in medicine usually just means one thing: not yet diagnosed with disease. They soon will be. If they remain part of conventional healthcare, ignoring structural disease. If they have normal labs and normal imaging, they soon will be with disease, guaranteed. That's what's going to happen, without a doubt. So let's look at the hierarchy of health metrics. And so let's talk on a foundational level about structural health. Okay, these are physical substrates of disease and aging. They change slowly, reflect a cumulative lifestyle and choices, and they drive downstream disease that everybody else is following. Okay, downstream disease rather than following structural health, this foundational level. So it is visceral fat, again, this intra-abdominal fat right here, this white stuff in the middle. And it's also epicardial adipose tissue. The adipose tissue is fat. Epicardium is the surface. The epicardial space, this fat is adherent to the myocardium, right in that epicardial space, and completely ignored by conventional medicine. Go have a conversation. Like, who should know about that? What are those fellows working on the heart called? The cardiologists? How about cardiothoracic surgeons? Yeah, let's talk to them. They're cutting through it. What can you tell me about epicardial adipose tissue, that inflammatory fat around the heart? Does that cause heart attacks or atrial fibrillation or cardiac dysrhythmias? That's going to be a short conversation. They won't know anything about it because they weren't taught about it in medical school, they weren't taught about it in residency, and they weren't taught about it in their fellowships. Had they been taught about it, they would work like Hades to get rid of it out of their patients because it's the number one tissue. The biggest threat you have in your life is that fat around your heart, completely ignored by this system. You want to jump in AI, learn about it, find the studies yourself, because your doctor will not know about it. Hopefully, increasingly, we're going to change that. But right now, for the time being, your biggest threat, most likely, you're going to die from a heart attack or stroke, and it's going to be from this fat around your heart or fat going on within your, causing you to have a compromised cardiovascular system. And then second area or third area is myosteatosis, which I showed you, this fatty streaks within the muscles. That is fatty muscle replacement of muscle with fat. And then there's liver fat. It's also downstream of visceral fat, pancreatic fat, which is also downstream of visceral fat, but they are all just sequelae, further examples downstream happening eventually. First thing happens is that visceral fat, and then heart fat, and then muscle fat, and then we see liver fat and pancreatic fat, and then fascial integrity. So what is fascial integrity? Well, the fascia is super interesting. The fascia is Scarpa's fascia, and it was that membrane that I showed you right here, this black line right here. The integrity of that, by the way, nobody talks about this fascia, but do you know it connects your fat with your arteries, your veins, your capillaries, your nerves, your bones, everything. It connects it all. It is your network, your wiring, and who have you even thought about it? Name one other thing that connects all of that. It's this, and here's what I've noticed. As people get better and get rid of this deadly fat, this becomes darker and bigger because it's getting healthier. And people start communicating their tissues physiologically way better. Never even heard about it. Go talk to your doctor. What can you tell me about my fascia? That'll be another short conversation. So how did we find out about it? We saw it getting darker and bigger. When we got rid of this stuff, we saw this getting darker and bigger. And it part explains why the continuity physiologically, the entire body gets better because this fascia network is now working cohesively all together. So fascia integrity is an important marker of your health or disease. If it's poor and it's really hard to see, it's compromised, then you got disease. And just the opposite, if it's getting bigger and thicker and more prominent, then it's healthy. So those four things are the most important metrics because they represent actual hardware damage. When those four are compromised, your hardware is compromised. Right now, it's completely ignored by your doctor and the conventional healthcare system. So labs can fluctuate, but the fat in and around your organs and your fascia are objective, visible, and predictive of either health or disease, depending upon the states of this. So functional capacity is on a performance level. So let's talk a little bit about functional capacity, how the body performs under demand. Okay, exercising when there's a demand on the body. These particular metrics I'm going to talk about reflect real world capability and resilience. Okay, so that is strength, grip strength, what you can do with weights, push-ups, pull-ups, deadlifts. Those are metrics of strength, and they all correlate with survival and really your quality of life. Also, speed and power, how fast you are and the power you're able to generate. Sprinting, vertical jumps, explosive capability and capacity, those go to speed and power, and mobility and balance. Just how mobile you are, how well you walk, how you get your butt out of a couch or a chair or of a car. You move across the stage, you see these older people falling apart. Their mobility is bad, their balance is bad. So those go to functional performance, how well performance level you perform, and then your gait speed, your walking capabilities, your reaction time, how fast you can react. Well, people, cars pull out in front of them and they just crash right into them because the reaction is so bad. So you check your reaction speed on humanbenchmark.com. Go to that website, track your reaction speed to visual cues, and see that you're falling apart. You're not getting better. You're falling apart. Unless you're one of my clients, I get you better because I get rid of the structural disease that's causing you on a performance level to function less and perform much less. So functional tests show what your structure can do. They're far less confounded than laboratory markers. Way more important to be following than a single laboratory value or multiple laboratory values in a single point in time. All right. Third area is physiological resilience. Okay, I call this, a control layer. So how the body adapts to stress and recovers. How it recovers. So heart rate variability and resting heart rate, your sleep architect, how you doing in your sleep, and recovery time, post exercise, and lactate clearance, how well you recover after how fast you recover, your lactate levels, and then your how sore you are, and how fast inflammation resolves after intense physical encounters and exercise. So uh, uh, another area is hormonal rhythm. Okay, so the stability of your cortisol curve, your circadian alignment, not just a particular static level, but you want to look at that dynamic nature. What you want to see, cortisol is boom, blows up when you get like you do sprinting or you do a bad butt or hard ass workout, you blow that cortisol up, and then it comes down quickly, recovers, rather than it stays up there high. You do a lot of durational exercise, it's going to stay up there. And the healthy you are, boom, boom. Less healthy, not so high, and it comes down really slower. Okay, you want to blast and recover. That's what a biological badass does. Somebody who's really healthy will have that kind of reflection in the cortisol levels, but it just no one ever talks about it because it's so spurious. So way more important to be tracking your visceral fat, your heart fat, your muscle fat, and your fascia integrity than to be tracking your hormone levels at a single point in time. So those levels reflect adaptability. They're better to look at over multiple times, not single values. They reflect the nervous system's integrity with metabolism and recovery. So really more important to be pay attention to that over a period of time rather than how physicians now look at a single point in time. They do your blood work and come in and they talk to you about it. What about the microbial and the metabolic ecology? So I call this the biochemical layer. And so instead of single lab points, it's about ecosystems and trends. So you want to look at your microbiome's diversity and stability, and emphasis particularly on metabolites producing species. So species that produce favorable, beneficial metabolites, and not just a list of what is present in there. You want to know which ones are producing the good metabolites that are beneficial for us, and also and then the signatures of your metabolomes. So these metabolome signatures, like short chain fatty acids, that we know are important to our health, and nitric oxide, some species of microbes that produce nitric oxide, and then precursors to those, and ketones, like you get when you fast and you are abstaining from carbohydrates, which suppress those ketogenic pathways. So you want to be assessing those particular signatures, and then glycemic variability. So continuous glucose monitoring is more useful than a single glucose at one particular point in time. But ultimately, I wore CGM for 4 years. Yeah, I stopped wearing it. It didn't really help me. Help me get rid of my visceral fat, my heart fat, my muscle fat, because CGMs, even if you track it, you get all worried your glucose went up. Well, did it go up because you ate, Krispy Kreme donuts, or did it go up because you did pull-ups? You see, it's confounding, and you really don't know, or some other factor, poor sleep, or you sprinted, or you went out in sunshine and built, some vitamin D and some nitric oxide, but it caused your blood sugars to go up. So how are you going to figure that out? It's just so, but go ahead and rely on it. That's what your doctor is. Lots of money in it. Well, your fanny is falling apart. So you want to get rid of the structural disease. That's what you want to be paying attention to rather than these single point lab values in a particular point in time. So this is where labs could be more useful if they're applied dynamically and in context. So you have to understand it, and it requires a lot of interpretation instead of this single point reliability. Once in a year or twice a year, you go in and get a whole battery of tests, and they're practically useless, or maybe more realistically, they're just harmful. They're causing you to get the wrong impression, and it's just a deficient approach, fundamentally a poor approach. Basically, what I think labs are just absolute BS, absolute BS. There is a value, and I'm going to get to it in a little bit. I will move to labs, but not just yet. Let me get to when they a whole different paradigm about how you should think about labs. All right. So the subjective objective interface at the quality level. Let's talk a little bit about this. So cognitive clearability. So your reaction time, your memory, your decision making under stress. These offer some clarity on your cognitive capabilities. Do you know you should go into your AI LLM and ask AI, ChatGPT, or Grok? Ask it how you're doing. How's my cognitive capabilities? Am I declining? Am I getting better? You know, it tracks that and can measure you against other people. And I was very grateful to see that mine is dramatically improving my cognitive capabilities over the past year and a half since I've been using AI. My analytical capabilities are dramatically improving, while rest users are plateauing or getting worse. Why? Because they're falling apart. They got this big chunk of fat around their heart. They have all this visceral fat. They have all this fat in their muscles, including their smooth muscles, which are providing blood flow to what? Their entire body, including their brain. And they're being allowed to fall apart. So you want to be tracking where you are cognitively. And I am so happy that my cognitive capabilities are dramatically improving the past year and a half at the age of 62. Oh, yeah. Oh, yeah. So super happy. It's a great measurement. And by the way, 800 million users using AI, lots of people to compare yourself to dramatically test your sensitivity. So you should go in there. If you're not, it's way better than doing a little single test at a particular point in time, like a neurologic uh, mini metal status exam or some other small little test. You really AI is fantastic at comparing you. Hey, how am I doing compared to other people in my analytical capabilities? How I use this and analyze and think about stuff. Also, mood and affect. Okay, that's an interesting metric. I see that improving dramatically. Improvement in the mood and the affect facial expressivity of my clients dramatically become much more expressive. I get down from being, older people that talk like this to be more expressive, and they start acting more like a 60-year-old or 50-year-old. It's fantastic. See this renaissance of their expressivity coming to life in their face and their mood and how they are living, because they're getting rid of this inflammatory fat that you got that you don't know about that is robbing you of the quality of life that you should otherwise have. And then sexual functionality, okay? Erectile capabilities, how good of an erection you get, your clitoral engorgement, how, we need to have female researchers looking at the engorgement of the clitoris. It shouldn't just be, God, we just dominate erectile functionality in the males, but we ought to be looking at the equivalent of that in clitoral engorgement in females. Women should be having, really traumatic engorgement of their clitoris, because males, we pay so much attention to our erections. Females, I guess, pay attention to male erections too. But engorgement is really important on a female perspective, and then the quality of that erection. How firm is it, and then also does it do something that I have never heard about till I became a researcher? of visceral fat and a practitioner of getting rid of it more than anybody else in the world. I got more experience getting rid of it. And what I see happen, old guys get increasing better erection capabilities. And then it starts a little bounce, and then it gets a really major bounce. Like when you were 15 years old, you had this big bounce. And so the quality of your health, how healthy you are, is reflected if you're a male, and the quality of your erection and whether you got a big bounce. And if you got a little one, that's better than no bounce. But if you got a little one, you're more diseased than somebody's got a big one. Like when you were 15 years old, 17 years old, you had this massive bounce with every heartbeat. And so the quality of your erection goes to how healthy you are because it's a reflection of your blood flow. And getting rid of that fatty deposition within your skeletal muscle that we see right here, the largest part of your arteries and your veins and your capillaries are in your are the smooth muscles. And so they get infiltrated with this inflammatory fat, and you're running around taking blue pills and all these different medicines because you're trying to treat that instead of fixing an underlying disease. They're just throwing pills at you instead of getting rid of this stuff that's going to cause you to have this renaissance, this whole new improvement, resolution of all your chronic disease that you're having because they're just treating symptoms with medicines. And then the other senses improve, your hearing, your taste, your balance, all of those improve. Wow, my God, my taste is so much better than it ever has been. I guess this is the way food used to taste when I was like 20 years old, but I forgot. But my God, as I keep improving, my senses are so much better. And I'll do some more about this. Yeah, I don't want to go too off down the road, but I'll do some more on this down the road eventually. And then so these particular areas I just talked about are early warning signs. Okay, of systems. Patients usually feel improvements in this layer before the laboratories start catching up. So, if you're just tracking these labs, they're going to be a poor metric for actually detecting change in these particular areas. So the key takeaway are labs are lagging indicators. They're way downstream. They're all downstream to this stuff. Okay. And you're hanging out in downstream territory. Fix the head of the snake. Okay, kill it. This is where it is. You're chasing the tail. So labs are lagging indicators. Structural disease like this and fat around your heart and fat in your muscle, they're leading indicators. First thing you should be taking care of and getting rid of. And then functional resilience equals real-time indicators. So we talked about that above. Functional indicators, how you function. So if you want to, if you flip the current paradigm, the conventional approach, first declare health and disease based on structural disease, these things: visceral fat, heart fat, muscle fat, deep subcutaneous fat, and then also structural health from superficial subcutaneous, this stuff. Why is this so good? Because it's filled with adiponectin. It protects you from heart attacks and strokes. This is your protective layer. It's like putting a bulletproof vest on. My God, you want it. And they're telling you to get rid of it. The bodybuilders model it, six packs, they got nothing. And women are getting liposuction. And it's a tragedy that the doctors going along with it. We physicians should know about this stuff to warn, but nobody's warning about it. I have these women writing me messages. The worst thing I ever did, doing liposuction, made my face less attractive. I ended up getting a masculine voice, and I started trying to look like the fellas, trying to get a six pack, and my health got worse because this superficial subcutaneous fat is so important to you. So that's why we got to be teaching doctors about structural health, structural disease, looking at this, and then tracking improvements for functional performance, resilience metrics. Okay, all those will improve as you optimize, get rid of disease, and you optimize your structural health. So labs should only be supportive, but they should not be primary and not done first. So few physicians, if ever, ever articulate that lab values only have meaning once the underlying structural disease is eliminated. So what does that mean? Here's what I'm saying. These labs just don't have any value to get rid of this stuff. Then they make sense because they're lagging behind this. And when you have all this, it's obfuscation. So all your laboratory studies, your doctor, are all confounded and confused by this stuff that's being ignored. So once you get rid of this, then these lab values become super powerful, like C-reactive protein. You should have none. Get rid of this stuff, you won't have this clutter where you have a higher level of C-reactive protein, and then when you exercise, boom, boom, goes up and goes down. That's how you should be looking at it. Instead of like, well, my C-reactive protein is elevated because of I got arthritis, I got bursitis, I have this cancer, I have this and that. It's all this milieu downstream, lagging indicators. Laboratory values really make the most sense and have value once you get rid of structural disease and you optimize structural health, and particularly the superficial subcutaneous fat and that fascia membrane there, scarpus fascia, and you optimize those two things, then laboratory values really make sense. So labs in the disease state, structural disease is present with visceral fat, heart fat, myosteatosis. Then there's confounded signals. Okay, these labs reflect just basically metabolic smoke. Okay, not the fire. It's all downstream. It's not the real problem. And so and then C-reactive protein, A1C, whatever you're following, LDL, insulin, uric acid, they're all distorted by fat. Fat depots, structural disease, visceral fat, heart fat, muscle fat, and chronic inflammation. And then low specificity is a problem. They're not specific to a particular event. It's a bad lab, value that you get, that you're told about. Might mean visceral fat, might mean infection, might be sleep deprivation or stress or whatever. But this is a problem. And then there's the lagging indicators again, that structural disease can worsen, over years. This stuff is accumulating inside of people while labs remain completely normal. So this stuff is growing inside of you, but your labs, they're way downstream, don't reflect the tsunami that's coming your way. And then all of a sudden, I don't know what happened to me. I've just fallen apart. Well, you would have known what happened to you if you were 20 or even when you were 5 years old. If you'd gotten this MRI, like my clients come and bring their kids and get them scanned, and we can see them, we turn them around. They're going to be superhumans while your fanny is still falling apart. I don't know why my back still hurts. I still get chest pain, but I keep my nitroglycerin. Good God, man. You're going to stroke out. You're going to get cancer because you're ignoring this. But my doctor, oh my God, we have got such a problem. If you're listening to me, please, dear God, get an MRI scan. Go figure it out. Get it and get rid of this white stuff. Get rid of this structural disease, because otherwise you're following these labs. You are following spurious results. So in this setting, in this kind of disease, labs are just noisy. They're misleading, and at the very best, misleading, and really probably just harmful. They just are keeping you from optimizing or finding out what you really should be doing, which is following a structural disease. So labs, however, in a recovered state, where you've gotten rid of this structural disease, where structural health has been restored, you're a human being in your 70s and 80s. You got no visceral fat. You have no heart fat. You have no muscle fat. Once you're in that particular state, you're reversed. Then you have optimized fascia and superficial fat. Then these labs are clear signals, exactly what you should be following, but not before. There's no chronic inflammation underlying, because all those structural disease, there's no distortion. The labs reflect accurate acute changes more directly, what's going on. You know, like I mentioned, C-reactive protein, when you work out, that's accurately measured. It's not concealed. You know, your capacity, like how good are you at making that C-reactive protein? You know, if you've got all this disease, you're going to suck at it. You're going to suck at making that inflammatory response, that C-reactive protein. You think it's so bad? When you got all this stuff in there, you go just a little bit. But when it's all gone and you're 70 years old and you do some push-ups, boom, back. That is a biological badass. You'll never get there until you get rid of this disease. So you got to grasp the utility of this. Also, the higher sensitivity, you know, these deviations, just a little deviation from baseline becomes way more meaningful when you have this gone. You can detect these little tiny changes if you use in labs after you got rid of the structural disease. So you eliminate that confounding that is otherwise present until that goes. So much more useful than to track trends. That's where I like labs. Labs are great once you get rid of the structural disease. But until then, they suck. They're misleading at best, and more accurate, I'll say they're BS and they're just harmful. We'd be better off without them. If we're going to ignore structural disease, we'd be better off not doing the labs. But get rid of that structural disease, then they really take laboratory values to a new level. But that ain't going to happen. It's not likely. The conventional healthcare system is going to start promoting that anytime soon, because there goes the system. No, you know, everybody gets healthy, and then what are we going to do? The biggest pot of money is used for chronic disease. So, you know, the muddy, misleading labs that we have now you really could turn into these fine tuning labs that would really optimize human beings, but we got to get rid of structural disease. So why these labs still lag behind structure? Even in the healthiest people, the healthiest, you know, possible states, they're going to be lagging. They tell you only results that are downstream shifts and after the structural system is already altered. So they can you can still manipulate these things by transient factors. Okay, stress, changes in sleep, exercise, very manipulable. You know, with a lot of confounding. So they're poor poor utility in conventional medicine, and they interpret them again in just the particular static point rather than understanding from functional and a structural health and a structural disease. So it's really important to grasp this distinction. If you cannot grasp it, you're just going to be stuck in this paradigm, a conventional approach, and just disease. So at best, laboratory values should be thought of as just secondary. They're used like use an aircraft analogy. I have several pilots that come to me as like secondary instruments. You know, helpful for cross-checking. But the structural disease there is the radar screen. Okay, the imaging is the primary flight control. You want to be tracking structural disease and structural health. Those are your primaries instead of cross-checking. Right now, everybody's doing cross-checking and they're not paying attention to the primary system. So with structural disease, labs are mostly garbage. They're BS, confounding, misleading, and really just erroneous and, in my opinion, dangerous to follow unless you get rid of structural disease. And without structural disease, when you do get rid of it, then labs gain precision. They add fidelity. Then they're beautiful. Then they're helpful, but only as refinement tools. Okay, they're not primary. They're not your primary compass. They're not your primary system that you're going to be operating on. So to put it bluntly, labs only become interesting after you removed structural disease. Before then, they're just smoke signals, you know, in a burning house. So you got to get rid of the structural disease. And so first option is really direct and powerful is till you to understand is until you eliminate structural disease, labs are just lies in numbers. They're just erroneous and misleading, and you buy into them. And only after the structural disease is gone do they begin to tell the truth. Okay. So they're lies until you get rid of this stuff. And you're following it. You're stuck in it. You're stuck in this paradigm of a conventional disease promoting system that profits from it. So 1 in 1,000 are going to listen to me. Maybe 1 in 100,000 will get an MRI. And 1 in 1,000 maybe we'll try what I've been telling to do. And but if you notice, people that do it, if you follow me on social media, their whole lives are changing, even without coming to me. If they even do what I'm telling them to do to get rid of this visceral fat, but boy, you really change if you adopt my strategies and get an MRI and target that and work like your tail off to get rid of it. So. Structural disease defines health. Okay, how healthy you are, how diseased you are. Lab values only gain meaning once the structural disease is gone. Otherwise, it's just a misleading guide. All right, so I'll leave you with this one thought. Labs follow structure. You fix that structure first. Okay. That's what you need to do. Then the labs will matter. Until then, they don't matter at all. I'm going to have a second part to this where we can look at it a little bit later down the road. But I want to get this out there so that you understand it and benefit from the utility of getting rid of your structural disease and optimizing your structural health. All right. Well, thank you very much for sticking with me. If you like this video, you like this, I mean, you've never heard a doctor talk about this. Isn't it worth a like? Please. Isn't it worth a comment? If you comment, one, I like to comment. I like to see that this is getting somewhere, and it also gets more attraction. Algorithms will share it with more people, and I'm trying to disrupt healthcare. Anybody else doing this? No. So please help me in my mission. Give it a like, subscribe to my channel, and get this out there, and then share with other people, okay, so that they can begin to realize that. Share with your doctor. Get your doctor. I can tell you, your doctor's not intentionally trying to mislead you with these labs. They actually are working with what they think is the best that they have. They don't know about visceral fat. They don't know about muscle fat. They don't know about heart fat. They don't know about deep subcutaneous fat. They don't know about scarpa's fascia. And they definitely don't know about superficial subcutaneous fat being super, super protective and beneficial. So share this with as many people as you possibly can. I thank you in advance for supporting my channel. And please forward this to others, loved ones that you care about. And, consider coming to my practice and be seen by myself or one of my doctors. So you realize, God, this makes sense. I'm getting rid of this stuff. I'm going to change my life. Or just keep kicking the can down the road and keep getting diseased. Okay, Dr. Sean out.